So I'll introduce myself first. I'm Kate Ballinger, so I'm the Community Engagement Facilitator at Shrewsbury and Telford Hospital. And I'm joined today by my colleague Rachel Higgins, who works as part of the engagement team in the volunteer section of our team. So Rachel, do you want to say hello and just to explain what your job role is now? I'm a bit lost.
Hello, good morning everybody. My job has changed quite dramatically in line with the pandemic. Primarily my role at the start of the year was volunteers coordinator for the trust. So I look after, manage, recruit, attract and primarily look after our 800 volunteers that we have across the two hospital sites. This has changed in line with responding to the pandemic. We sort of diversify my job role slightly to also include community engagement and charity work as well. So really there's sort of three strings to my bow. So volunteers, community engagement and ultimately in the not so distant future charities as well. So I'm very lucky. I get to sort of dip my toe into all three aspects of the team. So yes, that's a little bit about me.
Okay, so if we could go on to the first slide there, please, Tom. I'm just going to give you a bit of background about the hospital, and obviously because a lot of people see the hospital only when they have to. It's interesting to know a little bit more about it. So what we thought we'd tell you is that the Shrewsbury and Telford Hospital is the largest employer in Shropshire, Telford and Wrekin. In fact, that's point 3, but anyway. So if we start off, we are the main acute hospital provider across Shropshire, Telford and Wrekin and Mid Wales. So we deal with is mainly Montgomeryshire in Powys. And the reason for that is that an acute hospital needs to have a population of 500,000. So between Shropshire, Telford and Wrekin, certainly at the last census in 2011, the numbers were about 470,000, which didn't quite give us enough to provide some of the services we provide in England. We do, however, provide services to about 70,000 people who live across the border in Wales, and that pushes us comfortably over the 500,000 number, which we need to do to provide some of the services that we provide. And that includes things like radiology, radiotherapy. So some of the cancer services that we provide, we wouldn't be able to provide if we didn't have 500,000 people that we were providing to. It's probably true to say now that there are more than 500,000 people in Shropshire and Telford and Wrekin, but we will continue to provide services to Mid Wales because there are no acute hospitals in Powys at all. So the nearest trauma unit when you come across the Irish Sea is in Royal Shrewsbury Hospital. That's the first one from the coast over in Wales. And as I say, that's a trauma unit, not a trauma centre. The nearest trauma centre would be at Stoke. So UHM in Stoke, University Hospital North Midlands. So it means that we're in a really fortunate position because we are able to provide a lot of very essential services to people in lots of different areas. Of course, that brings with it its own challenges because there is a lot of rurality across, certainly across Shropshire and Mid Wales. But there are areas in Telford as well where rurality is an issue. If you lived in somewhere like High Arkle and didn't drive, you would have real problems getting into the hospital. So we have to be careful that when we're offering services, we're offering them in a way that makes them accessible. So it says here the Trust catchment stretches from the Cambrian Mountains in the west to Newport and the fringes of the Black Country in the east. It is a fairly huge land mass, but the population isn't as dense here as it would be somewhere like Wolverhampton or Birmingham. So we employ almost 6,500 staff, about 6,400 and some it was last time I looked. And within the Trust then there are hundreds of staff and students from other organisations. So things like Keele University send medical students to us. We have nursing and midwifery students from across the West Midlands. And obviously we also work with some of the local education places where we have students on apprenticeship rotations. I think that one's coming to an end now, but we were working across the colleges in Shrewsbury and Telford, to take students who were on a health and social care rotational apprenticeship. So they did some time with us in an acute hospital. They also did some time in GP surgeries and care homes, which is really, really useful qualification when they get to the end of it. So at the start of the pandemic, our hospitals had just over 700 beds and assessment and treatment trolleys. That is going down now, because obviously we have to apply social distancing. So our bed base has been cut quite dramatically since March. And we are looking at different ways of delivering services to make sure that we can still deliver a safe and efficient service, given the restrictions we've got in place. So we were talking about putting in some modular units to make sure that we've got enough beds, because when we talk about restoration and recovery of services following the pandemic, we have to make sure that we're able to provide the services we need to provide for our population. Okay, you can see there that the turnover is about 360 million. 54,000 elective and day case spells, they obviously have been put on hold since March. So if you work it out, half of that, so there'll be 27,000 people waiting to come in for an elective or day case surgery now. 58,500 non-elective inpatients spells. So they're people who've come into A&E and they have come in either by ambulance or by car to an A&E department, and it has then been assessed that they need to stay with us for a period of time. 6,500 maternity admissions. Not all of those will be babies, because I think we deliver about 5,000 babies a year, but one pregnancy can involve several admissions before the baby's actually born. So nearly 500,000 consultant-led outpatient appointments, and that's something that we are working quite carefully around to make sure that we're doing that as safely as we can. So I don't know if you're aware that we've started delivering outpatient appointments using a service called Attend Anywhere. So at the moment, some of the services, not all of them by any stretch of the imagination, but some of the services within the hospital are using video conferencing to provide outpatient appointments. And that is going to be something that stays with us. It was talked about in the Future Fit consultations. It's been talked about for a long time. I've been involved in health and social care, certainly around Telford and Wrekin, since about 2011. And all the way through that, people have talked about there being this ability to see somebody not face to face. And that's changing now. It's changed very quickly, it's changed at pace. But the feedback from patients has been fabulous, because if you think about it, if you don't have to leave home, if you can connect up from home, you don't have to travel into the hospital, you don't have to pay for parking, you don't have to try and find a parking space, which is always a problem at both hospital sites. So actually patients see it as a very positive thing. There are a few naysayers on the consultant side, but again, experience will show them as we go ahead that this is working well. And there are more and more consultants willing to give it a go and see how they can get on with it. Now there you've got nearly 137 accident and emergency attendances. That was in 2018-19. Those numbers are increasing all the time. Now, we will have lower numbers this year, because obviously we saw a lot fewer patients coming in through A&E through March, April, May. But the numbers are back up now, and we would expect that the numbers will be higher month on month now than they were previously. And then the bit that Rachel will be able to tell you far more about than me, at the bottom there it says there are currently approximately 950 volunteers active in the trust, and these volunteers cover everything from the League of Friends shop through to the people who carry the notes around between clinics. There will be substantially less than that working in the hospitals at the moment, because a lot of our volunteers are older. And one of the first things we had to do is to stand down anybody who is in an at-risk group. But Rachel, do you want to talk a bit about how you're recovering the volunteer roles within the trust at the moment?
Thank you, Kate. So as Kate very kindly introduced there, we have I said 800 before, that the presentation is detailed 950. That's also because we also do the volunteer checks for third-party organisations that come into the hospital, such as Red Cross or the ambulance service as well. So before COVID hit, we had around 800 active volunteers. Those volunteers were spread across the 2 hospital sites, Shrewsbury and Telford. Kate's quite right in saying, unfortunately, as soon as the pandemic hit, we had to act rather quickly in ensuring that our volunteer workforce were kept safe and well. Unfortunately, the dynamic of our volunteer workforce meant that a high proportion of those 800 volunteers had to stand down because they were over the age of 70 or living with an underlying health condition. We did have some volunteers that remained with us. We also, sorry, it's probably worth saying, we had to stop any of our young volunteers, and our young volunteers make up, again, a rather high proportion of our volunteer workforce. So that's anybody aged 16 and 17. So we had a couple of people remain, around 150 people decided to remain with us. But in addition to that, we had a lot of members of our community contact us and ask to come and help in the hospital during COVID. I think that probably was in line with the amount of people that were on furlough rather than sort of sitting back. And if I understand the rules of furlough correctly, that you can't actually gain paid employment, but you can go and volunteer. So we've had some wonderful examples of individuals and people in the community that have come forward. Teachers, magistrates, people that worked in retail, people that worked in hospitality, all come forward and help us in our efforts. We've managed to really sort of speed up our volunteer recruitment process. As I am working from home, as is Kate is, we had to find a way of doing this virtually. So we've managed to really sort of speed things up without cutting corners, and have found a way to do everything online, which is much, much better. And we included a quick Microsoft Teams face-to-face interview with volunteers before they started. As you can imagine, because of the pandemic, we had to pull the majority of our ward-based roles, as it was unsafe for our volunteers, even if they weren't high risk, to be going into these areas of the hospital that we class our red or our amber areas, so the not clean areas. So we've had many requests from across the hospital of other departments that would like volunteers to help during the last couple of months. And I'm pleased and very proud to say that we've had a lot of volunteers helping in phlebotomy with the antibody testing. Also, when the face mask covering rule came into place, we have volunteers stationed at the entrances and exits of both hospitals, handing out and distributing hand gel and face masks as well. We've had wonderful examples of volunteers that have come to help volunteer in the portering departments, who have then gone on to actually apply for roles within the trust and have been successful in obtaining full-time substantive paid roles in the trust, which is absolutely wonderful. We've had volunteers that have helped out in the charity department at distributing the wonderful donations that we've had from individuals and companies over the whole of the last couple of months, which has been fantastic. We've had volunteers that have come and helped with admin roles, sort of clinical audit type roles about patients' experience within the hospital over the last couple of months. So we really have changed the way our volunteers are recruited, trained, and also in which areas of the hospital they are placed. Moving forward, looking at recovery and restoration, we need to make sure that when we are inviting our volunteers back, that we do it safely. So we have various methods in terms of risk assessments and how we are doing that. I'm pleased to say at the start of July, we have started to welcome back our young volunteers, so our 16 and 17-year-olds, and that's brilliant because they've just brought an absolute breath of fresh air to the hospitals. It's been wonderful. And when we are advised, hopefully, we can't say when, we will be able to allow our over 70s to return as well. So hopefully that gives you a quick whistle-stop tour of how volunteers did work, are currently working, and how we hope to keep going in the future. I think we will struggle to get back up to the 800 volunteers we had initially, but what, you know, if you take a positive of something that has come out of this, is the real community spirit and those people that really want to come and get involved in the hospital and give something back. It's been tremendous.
Thanks, Rachel. Can we move on to the next slide then, please, Tom? So the next slide, I've called it Involving the Public. And actually, as a hospital trust, we have a legal duty to involve the public. So under the National Health Service Act 2006, there is I'm not sure exactly which paragraph it is, but if you, section 242 it is, sorry, I do know which section it is. This states that each relevant English body must make arrangements as respects health service for which it's responsible, which secure that users of those services, whether directly or through representatives, are involved, whether by being consulted or provided with information or in other ways, in the planning and the provision of those services. And then obviously the rest of what it says there. So we actually have to involve the public when we're looking at changing things. And as you would be aware, we're in quite a unique situation in our hospitals at the moment, in that we've got we are inadequate, classed as inadequate, so we are having to make some fairly large changes quite quickly to make sure that we're able to continue to provide services to the population across Shropshire, Telford and Wrekin and Powys. So as part of that then, our team, the engagement team, is responsible for making sure that we're going out and talking to the people who use the hospital services, who may use the hospital services, or who care for somebody who uses those hospital services. Because whether you are living with somebody who with a long-term condition who comes into the hospital regularly, or you're the parent of a child who uses hospital services, or you're working well and live in the areas, nobody knows when they're going to need to use their local hospital. So it's really important that we listen to everybody, or as many people as we can. So if we can move on to the next slide, please. We've got lots of different ways that you can be involved with the hospital. So the first one would just be to become a member of the trust, and anybody over the age of 14 is eligible to join our trust as a member. We have at the moment just over 10,000 members out of the population of 500,000. And anybody and everybody who would be interested in becoming a member of the trust is absolutely welcome to come and find out what's going on. What happens as a member of the trust is you would get invited to things like the annual general meeting. You'll get information from our quarterly newsletters that get sent out to our members, and increasingly we will use our membership as a way of sending out surveys about things that we're doing to find out what people think. So we need to make sure that our membership is representative of the whole of the population that we serve, so both geographically, in terms of protected characteristics under the Equality Act, in terms of different life experience. So we need people who are starting out, so the 14, 15, 16-year-olds, but we also need the people who are regular users of service, potentially because they're older or because they've got long-term conditions. So we absolutely would encourage anybody out there to become a member of the trust. We also have a very active social network. So the trust has many Twitter accounts. We have SaTH engagement, but there's SaTH corporate nursing, there's SaTH experience, which is the patient experience one. SaTH NHS is the main trust Twitter account. So anything that comes out through SaTH NHS, you know it's come from the comms team. They control that account, and they will put information out there on behalf of other people sometimes, but generally it's in line with the press releases and the work that's going on at the hospital at the time. We have a Facebook account, Shrewsbury and Telford NHS. All our jobs are posted on that Facebook account as well. So it not only has information about what's going on at the hospital, but if you're looking for work, you would find that there. We have an Instagram account. They have given me access to it. I don't use it because I'm really not very good at Instagram, and I'm going to pass my access to Rachel. I haven't told her that yet, but I'm sure she'll find out one day. Because Instagram is the way that you communicate with young people now. We've tried Twitter. Twitter doesn't work with young people. We know that. They think it's really boring. Facebook is old hat. Instagram and pictures are the way that people communicate more if they're younger. Facebook's great for people my age, people in their 50s, because I just look at it and find out what everybody else is doing. I don't have to put anything on about me. But certainly with Instagram, people like sharing, people like seeing, and we are getting much more active on Instagram now. We have a YouTube channel where all the films that we make within the trust get posted on there. So for example, the volunteers team did a lovely thank you to our volunteers video earlier on this year, which is available on the YouTube channel. We're also on LinkedIn, and I haven't quite got my head around LinkedIn yet. I'm not an avid LinkedIn user. I go in there and there's about 900 notifications, and they're all saying, congratulations on your work anniversary from last year or something. But LinkedIn, again, the trust is becoming more active on LinkedIn. And again, it's a way that people look for work now, I think. So you don't have to do anything well, other than have a look at our accounts occasionally and share and like our information that we're posting on there. But we have to be on the ball with social media, because it is the way that rumours spread. It's on the way that news needs to be shared to try and counteract some of that. And certainly at the beginning of the pandemic, we were getting notifications from members of our staff who'd seen on Facebook that there was somebody with active COVID-19 sitting in the waiting room at PRH-A&E. And I don't know whether anybody saw that on Facebook, but it went mad. There were thousands and thousands of shares of that post saying that there were patients in there with, and it wasn't true. It absolutely wasn't true. But what we've got to do is we can't counteract that on Facebook. What we've got to say is that if you want to know what's happening at the trust, have a look at our accounts, because they will tell you what's actually happening. We can't stop people naming us and checking into places at the trust. But if you want to know exactly what's going on, please use our accounts. And if there's anything you need to know, we will put it out both as a press release and through our social media. Okay, if we can move on to the next slide then, please. The next slide is about active opportunities. So these are ways that you can come along and talk to us or find out a bit more about what we're doing. So we have community engagement meetings once a quarter. We were doing these previously twice every quarter, once in Shrewsbury and once in Telford. We missed the ones in March because we had to cancel them at last minute when everything shut down and everybody moved home. But what we have done is we've reinstated them, but as virtual meetings. And this is, as I said earlier, I think this is one of the ways that things are going to change for us as a trust. That where previously we've put on coffee and tea and invited people to come and have a chat with us and meet them and shake hands with people and really enjoy being there, which is my favourite thing in the world. What we're doing now is saying, get your own coffee and tea and we'll talk to you online. So the community meeting, we had over 40 people come along to the community meeting in June, which was when it would have happened face to face. And actually that was a really positive meeting, because of the 40 people, probably 8 or 9 came from the trust. So there were people presenting and people who just come along to see what we were doing. But nearly 30 members of the public came along to that meeting, and it worked quite well. I think we can always do better because it's a new thing, but it worked quite well. And on the back of that, then we've started up a Tuesday afternoon drop-in session. So this afternoon I'll be online from 2:30, and anybody can come along to those meetings. You don't have to book in; you can just turn up. You can ask questions about whatever you like, because if we don't know the answer there and then, we'll go away and find it for next week for you. And we've had some really, really good conversations with people in those drop-ins. We had Helen Harvey, who's our pathology lead. She heads up the whole pathology department at the hospital. We were being asked questions about testing for COVID. And she was able to come along to the meeting and talk to people about exactly how that's impacted on her team, how we're managing it within the trust. And that's the kind of thing that we can do. So it's much less formal than a community engagement meeting. We don't have directors or anybody there. It's just me, our team, and anybody else who wants to come along. So as I say, they're every Tuesday afternoon, 2:30 till 4:30. We have a People's Academy, which I don't know if you're aware of, but the People's Academy was set up in 2018. The first one started in January 2018. And it's an amazing thing for me to do, because it allows me to show off a bit about what we do in the trust. But it actually gives people the opportunity to find out what happens in the hospital. So you get a chance to go behind the scenes and have a look at the pathology department, which as a patient, you would never go in there. As a member of the public, you would never go into a pathology department. And it's full of really exciting, there we go, value judgment, but it's full of really exciting robots and machines which test blood samples. And one of the questions that was asked by somebody on one of the tours was, how many blood samples do we receive annually? And it's 500,000. So if you think about that in terms, it's one for every person that lives in the county. Now obviously there will be a lot of people who don't get blood tests regularly, and people like me who have them every quarter. But 500,000 blood tests go through our labs every year. And that, as I say, you wouldn't get the chance to see that happening any other time. So we also take people into radiology to have a look at things like an MRI scanner, because most people will only ever see an MRI or CT scanner when they're going inside it. So the chance to see one without it being a procedure that's happening to you, to talk to the staff who are very, very knowledgeable about what the machine does, how it works, what the experience is like for the people who go into who need to have the process done to them, has been really positive, both from the staff point of view, because they don't get the chance to do that very often, so they like showing off too, but also for the people who may be a little bit anxious about coming in. So that was the start of that. So we talk about how the NHS works, we talk about how the hospital as a trust works, we talk about what the populations are like across Shropshire, Telford and Wrekin and Powys, because we found that there were a lot of misconceptions about what people living outside of your local area were or what their characteristics were. And you find that there are a lot of similarities. For example, you know, Telford, everybody talks about Telford being deprived, and there are areas of Telford that really are. But that's not to say that there aren't similar areas in Shrewsbury. And that's always a bit of a surprise for people, that there aren't areas like that in Oswestry. And again, it's a bit of a surprise for people. Welshpool, Newtown, both have quite significant deprivation. We talk about population characteristics, and one of my favourite ones is when you ask things like national level of obesity, and people find out that Shropshire people are actually more obese than Telford people, and that was always a bit of a surprise for me, but it's certainly a surprise for the people who come along to the academy. And it's looking at things like that. We look at smoking rates and whether, you know, we know that, for example, that smoking rates in pregnancy are a real concern in health across the whole of Shropshire, Telford and Wrekin and Powys, because you would like them to be zero. But they are significantly higher in Telford and also significantly higher in Wales. So it's a bit of myth busting. And the reason for doing that is because when we get into week 4 and we start looking about how people can be involved with the hospital, when somebody comes in as a patient rep, they can only talk about their own experience. But if they have an understanding of what the population is like across the whole of Shropshire, Telford and Wrekin and Powys, they can ask the questions that maybe people living in other areas would want to ask. So certainly when we're looking at things like Attend Anywhere, you know, I've said the advantages are around not having to travel into the hospital and not having to find a parking space and what have you. And if you live in Telford and you're going to Princess Royal, it probably isn't such a major problem trying to get yourself to the hospital, because there are fairly regular bus routes running from around Telford, and you would get in without too many difficulties. But if you lived in somewhere like Market Drayton and you had an appointment at Princess Royal Hospital, there is no direct bus route from Market Drayton to Princess Royal, even though it's only a 20-25 minute drive. So somebody coming on a bus from Market Drayton to Princess Royal would have to go via Shrewsbury, and it makes it about a 2.5 hour journey to get into that hospital appointment. That's a hell of a difference, isn't it? If you think about it, how if they were going to Shrewsbury Hospital, it would be faster than coming to Telford, which is nearer. So it's about having that understanding of the whole, and being able to really contribute in those meetings, because you do understand a little bit more about what's going on. So the last week we look at how people can get involved. We hear from PALS, we hear from patient experience, the volunteering team come, and Rachel's done quite a few really good sessions with people about how people can get involved through volunteering. We do a Dementia Friends awareness session, and Rachel and Poppy, who work together, have been looking at how we can deliver that online, and I believe you're going to be starting doing that soon, guys. Sorry, Rachel, were you going to jump in then?
I was. Unfortunately, we don't have a date, Kate,
Okay.
but it will be mid-September. I think we hope to do it, more so as a practice, actually, because we've only ever done it face to face, so it'll be a new way of working for Poppy and I, but we've been guinea pigs for other trusts doing it, and it does work very, very well. It is very successful, so we are looking forward to doing that.
And that's actually something that we can offer out more widely. So we do it to the academies, but if it's something that any community groups or organisations or even employers would like us to do for them, then if they contact the engagement team, we can set that up for them. So that's the main People's Academy. We then condensed it into one day to offer it to young people, because we thought that the chances of getting young people back over 4 weeks was going to be fairly slim. And obviously there's a bit more of an emphasis towards work and qualifications, and if you're wanting to go to university or do work experience with the trust, then you can make the connections with people in the trust who'll be able to help with that. We've also developed a session for Telford Job Centre, and we did one around entry-level vacancies within the trust. So we were looking at things like portering, domestics, we were looking at catering, admin roles, medical engineering, stores, all kind of band, we call them band 2, so there'd be entry-level roles for people. But if you're coming back into work after a long time out of work, perhaps you want to start there. And the big thing about working for the NHS is that once you start, the opportunities just keep coming, so you can always look to progress. The other People's Academy that we developed before all this started was an academy for adults with learning disabilities, and that is my most joyful part of my role so far, because to be able to create something that helps to reduce anxiety for people coming into the hospital has been amazing. And we started the first one around fracture clinic and audiology in Shrewsbury. So we had adults with learning difficulties come over to do a trial run of it. We'd done a video of going into the clinics for them so they could see where they needed to go. We had people in the room who worked around those clinics who could answer any questions. And the best bit for them was when we took them into the restaurant and let them try some patient food. When we came to Telford, we did one around pre-operative assessment. And again, it's a really anxious time for people coming into pre-op assessment, and regardless of whether you've got a learning disability or not. And in my head, if we can help to reduce that anxiety by making it more accessible, by showing you what's going to happen when you get in there, by talking it through with you. And the people, when you come in, they're lovely and they are absolutely amazing. The lady who helped us do that film had no idea we were coming into the department, and she just turned around straight away and helped us do it. So we showed them the film. We actually got together some of the equipment that we use within those pre-op assessment clinics, and the guys were able to have a go with it. And again, you know, you find out that it's the inflation of the arm cuff for people that makes that's really creates a lot of anxiety. And so they were able to use a manual arm cuff on me, and I still have two hands, so it wasn't that bad. But again, it helped them to understand what was going to happen. They could feel it as it expanded. They could feel it as it went down, and it really helped them to understand a little bit more about what was going on. And that's something that we will be looking to bring back in again as soon as we can, because those films, if we can get the films for the academies and put them onto the website, it makes the whole hospital more accessible to everybody, doesn't it? So that's, as I say, that's the most joyful part of the work I've done so far has been around those academies, because the smiles and the expressions that we got from people, especially when they got to try the food, were amazing. So again, we are developing an online academy. It will be very modular, so you don't have to do it all. You can just drop in and out as you want to. There will be sessions that you'll need to complete if you want to graduate. But then you can choose whatever else you want to come in and make it up with. So we think that's going to be a really good offer, available to absolutely anybody. And the beauty of it is that we can have as many people as want to come if we're offering it virtually. Our Microsoft Teams platform, we can have 250 people in a meeting. I doubt very much that we would get that many on an academy session, but it certainly means that we're not limited to 10 like we would be if we were running it in the trust. And then finally, if you wanted to get involved with us, then coming through an academy gives you the opportunity to become an involvement volunteer. And the involvement volunteers are the people we go to first when we're looking to get people involved in the Section 242 engagement around working with us to make things better. So you don't have to have any particular background to get involved in that way. You can, so long as you've been through an academy and you've got that sort of broad understanding of what the hospital do, then that's a really positive way of helping us to make our services better. And of course, the standard volunteering, which is the people who give time every week to come in, all come through Rachel and her team to make sure that we've got real opportunities for people to do what's best for them. This isn't about us saying, we need you to do this for us. This is about you saying, I'd like to get involved with you to help this way. So there are, I say, two different styles of volunteering. We currently have about 270 involvement volunteers. And that's amazing. 200 of them are young people. And for the first time, we've had young people involved in things like our patient-led assessment of the care environment. And which is so important, because if you've got one of those patient-led assessments going up ahead, and at one point we only had a 72-year-old man who could help with an assessment of a maternity unit. So by having more people involved with us, we were able this year to put a mixed group out and to make sure that we had what we needed for that. And as I say, a young person, amazing, because having a young person going in and looking at the children's ward, obviously completely different viewpoint and really valuable. So we're trying to open ourselves up to get people involved wherever we can, and to make ourselves accessible to the whole population that we serve. So if you want to go on to the last slide, which is the bit where I ask you if you want to talk. So any questions? And obviously the contact details for the team are on there. But if anybody wants to drop into the meeting on a Tuesday afternoon, I can certainly send Tom the link. In fact, you've probably got it on the bottom of one of the emails I've sent you today, Tom. We can share that with everybody, and you are more than welcome to come along and have a chat with us. So thank you. I think I've talked enough now, really.